Hi, I'm Amy Merritt, former Lee Summit School District Health and Physical Education Curriculum Specialist. And now I'm promoting a free healthy lifestyle program called Healthy Foundations. As a former teacher, finding quality instructional activities can be very time consuming, and developing your own activities takes even longer. To help with both, I'll be taking this time to introduce you to a health program that fits your needs. I believe you'll find this unique and innovative instructional program an activity you'll want to include as part of your health instruction. So, what is Healthy Foundations program all about? Well, the program provides activities to help students make the important connection between the lifestyle and behavioral choices they're making now, and if those choices are unhealthy, demonstrate how they can lead to a variety of preventable medical conditions. We know that helping students to develop positive lifestyle and behavior choices is an important skill for them to leave school with. This program provides you a unique way to make this connection and help students understand the impact it can have on their health and quality of life. Another feature of our program is that it's web-based, so it can be instructed either face-to-face, in a blended class instructional format, or all virtually. Students can access the program at any time and from anywhere there is internet capability. So, what activities will your students be doing throughout the program? Well, they'll be asked to research all aspects of the project and evaluate information to apply to their fictional patients' care. These fictional patients use real life, pulled from the headlines scenarios to set the stage to provide an engaging way for your students learning throughout the project. Students will practice and reinforce some of the skills-based health education standards, such as goal setting for nutrition and exercise programs, making decisions on how they will improve their patients' health, and collaborating as a team. Plus, many high school health education content objectives are covered through the program. They'll also be provided career education as students will explore the healthcare field as a possible career choice option, as well as investigate a specific healthcare profession. Finally, they'll be engaging with various healthcare technology infused throughout the program, making it more interactive for students. What does the program provide you as a teacher? Well, it addresses many health education content standards and state standards to help you meet expected learning objectives, as well as workforce skills. You'll get away from teacher-directed learning and move to student-centered learning, emphasizing students being responsible for their own knowledge and learning. Because the program is project-based instruction, it allows for in-depth learning and exploring instead of covering a lot of content with little depth. It's a very flexible program. It's up to you where in your unit planning you want to use the program, and within the program there are several ways to instruct it based on your teaching style and needs. We provide data to support program implementation by using post-test knowledge-based assessment. Lastly, it's just a well-planned program. We provide comprehensive training with a self-paced online training course for you. We provide all teacher and student resources for the program, website resources, and answers to all the questions. It's an evidence-informed programming. We use research already available, such as CDC statistics on death. All conditions are medically accurate. And then finally, we use teacher feedback to continue to keep the program relevant to support the needs of classroom teachers with innovative instruction. Now I'll share the specifics of the program so you can see the student activities. Since it's a project-based program, it'll take about 2 weeks to complete because it's an in-depth study of the relationship between lifestyle choices and health. So the first lesson is an introduction. It has a unique bell ringer activity called Awareness Card. See example images of the cards which are shown on the right of the slide. It's a teacher-facilitated lesson, approximately 50 minutes to go through the PowerPoint. And then it provides just a high-level overview of preventable medical conditions, as well as an introduction to the project for the students. You can move right into the second lesson called Meet Melissa. Again, it's about a 50-minute lesson, which can be taught various ways. Using storytelling, students follow Melissa as she is not feeling well and watch her as she navigates the healthcare system to receive the care she needs to improve her health. Students are introduced to her healthcare providers and how they interact with her to deliver her healthcare. Students are also introduced to the website and then how they will be interacting with their fictional patient later in the project. This is the home page, or what we call the launch page. Both student and teachers see the same web page. To get to the introductory PowerPoint, click on the Causes of Death image, and this opens the PowerPoint presentation. And as you can see, here's the first activity, the awareness card activity. The rest of the PowerPoint is then the introduction to the project. To get to the Meet Melissa lesson, click on the image of Melissa. This opens to her story, as well as the lesson and the resources. You can find the resources in the Resources tab. And as students go through Melissa's lesson, you'll see there are questions after each section of her lesson. And then students can answer those questions on the recorded to turn in to you. Before starting the next lesson, students will take the pre-assessment, which is 8 knowledge-based questions. Some of the questions they'll answer are about the symptoms, causes, diagnosis, long-term effects, and prevention of their medical condition of the patient. Then the third lesson is the healthcare roles lesson. Students are now in teams, and the groups will learn about the healthcare field as a career, as well as explore a specific healthcare profession. There are 6 professions. There's a physician, nurse, technologist, medical and health services manager, health coach, and a pharmacist. This lesson will take approximately 50 minutes. Then the fourth lesson, the teams meet their patient. We have 8 fictional patients you can choose from for student groups to explore. Because they're exploring in depth, this lesson will take approximately 100 minutes or a block class time. In this lesson, the team studies their fictional patient's symptoms, investigates to make a diagnosis, and then researches the treatment for the condition. Let me introduce you now to the patients we offer. Starting in the left-hand corner, we have Brittany. She's texting while driving, gets into an accident, and has a traumatic brain and spinal cord injury. Next is Ryan. He drinks too many energy drinks and has cardiac arrest. Then there's Rob. He's a longtime smoker, goes to the doctor because of some symptoms, and is diagnosed with lung cancer. Then we have Stephanie. She loves tanning beds. She doesn't wear any sun care products. All of a sudden, she notices a suspicious mole, goes to the doctor, and is diagnosed with melanoma. Then the last 2 on the bottom, first one is Stuart, and then Taylor, his son. Stuart is a longtime type 2 diabetic. He does not manage his diabetes and ends up having to have his leg amputated. And then there's Taylor. He's a high school 15-year-old, has symptoms, goes to the doctor, and is diagnosed at 15 with type 2 diabetes and begins medication for treatment. These are what we call our 6 regular patients. The other 2 patients along the right side, the top one is Maya. and below her is Pam. Maya is a stroke patient. Pam is a COPD patient. We developed Maya and Pam as modified patients for students who are lower academically or for students who are on a modified educational plan. You can group those students together and they can work through a patient just like any other group and participate in our program. Let's meet a patient. Clicking on the Patient tab, this section is where the patients are located. We'll use Brittany as the example. All of our patients have 6 sections. The first section is Meet the Patient. So Brittany's a senior. The group learns about various stressors Brittany's dealing with. And then she learns she's left her computer at a friend's house and is texting her about it and gets into a car crash. At the end of the section, there are questions for students then to start researching and looking at her lifestyle, as well as about texting and driving. Since Brittany's in a bad car wreck, she obviously goes to the emergency department for treatment, and students will begin exploring what her possible injuries could be. Again, they'll be researching this information and trying to diagnose her condition. Each patient has a role section. This is where students will individually explore from their healthcare roles perspective, Brittany's medical issues, as well as helping to lead to her diagnosis. So for example, if I'm the nurse, my questions would be around the nurse's responsibility to the patient and the doctor. Students will also be using various healthcare technologies, such as looking for information in their electronic health record, students will look and see what kind of tests are done on the patient, as well as what those test results are. We also provide what we call a virtual physical exam. Our virtual physical exam provides information about all the tests that are done on their patient. So if I'm supposed to answer a question about a CT scan, I can select that, and then there's information about a CT scan, what a CT scan machine looks like, and then information related to Brittany's injury and results. In the next section of Brittany's story, called Scary Words to Hear, the group researches the next treatment steps after diagnosing her and what are possible options. Then finally, Brittany is admitted to the ICU hospital for further care and recovery. What does that treatment look like, and what does her recovery look like? And then finally, all of our patients have a statistics page, which is just a summary of the medical condition statistics, which are provided in the final section of the story. We also provide resources for students to collect their answers, just like we did with the healthcare roles section. The medical and healthcare services manager will figure out a medical bill for Brittany, which Brittany's is over $100,000 cost of care. And she has an emergency department statement, as well as an ICU statement for all of her medical tests and care and medication and treatment provided. Finally, in the last lesson, called My Station, students will assess their fictional patient's lifestyle choices and behaviors, and then research and provide education to improve their patient's health status in regard to meal planning, goal setting, suggested lifestyle changes, even mental health self-care. The research to provide educational information as well as planning lifestyle changes will take approximately 150 minutes for students to complete, with the finished project culminating in a group oral presentation where they will provide their findings and lifestyle change plans. Once that's completed, then students again will complete a post survey. There's also what we call a Healthy Foundations wrap-up activity. This is for teachers to provide students a personal connection as they look at their current health and behavior choices, and then select 1 to 2 lifestyle changes they could make right now. So instead of it being about the patient, this wrap-up activity is about their own personal lifestyle choices they're making. We have over 20 health and wellness topics that you can choose from. There are 2 types of wrap-up activities. You can choose to do a teacher-facilitated wrap-up activity where we would provide you with the lessons and resources, and you would provide the wrap-up activity, or a Healthy Foundations team member could facilitate a lesson as a guest speaker. Whichever you choose, we have lesson plans and resources we can provide for all the wrap-up activities. Just a little bit about some of the data we've collected over the years. Since inception, we've seen a 14% increase in overall student knowledge from pre to post test. The last couple of years, we started collecting data about students' intent to change their behavior or lifestyle choices, and 51% said, yes, we'd like to make some changes. Then lastly, we always do a teacher satisfaction survey after you complete the program, and we're excited that we have a 99% overall satisfaction rating. Thank you for your time. If you go to our website, you can see the URL is provided on this slide. You can register to use the program. Just select the teacher registration button to get started. If you want more information, you can contact me, Amy Merritt, by email or phone. Thanks for all you do for your students.